Good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way in Yorkville, Illinois, right outside of Chicago. I hope you guys are having a great Monday. Hope you guys had a great weekend as well. We're going to talk to you today about part 2, about looking at cancer differently. And I'm going to talk specifically about lab markers that are going to leave clues. And these are things, actually, lab markers that I believe are better tests as far as trying to find changes in physiology so that you know where you're headed. And I'm going to make sure I give you guys a real great detailed explanation as far as why. Because remember, guys, you cannot solve the problem with cancer by looking at it the same way, especially when cancer is such a problem, especially here in the United States. So if you guys are joining us right now, please say hello. Please let me know where you guys are watching from all across the entire world. It is awesome to see so many people join us for these lives every single Monday evening. I'm honored and I'm humbled that you are spending your time watching me talk about different things from a different perspective as well. So guys, good news. If you guys follow Dr. Patrick Flynn on his Instagram page, he just made an announcement a couple of days ago that they do have applied their trademarks, to get trademarks within Canada, which means that soon there will be Wellness Way offices within Canada. So it's just a matter of time until there are some certain restrictions that are lifted, hopefully sooner than later. So Canada, be on the look for some Wellness Way offices. And then make your case known about where these offices should be. I know within the last week we've had requests to speak in Ottawa, Canada, Toronto, Calgary, and then also in the Vancouver area. So I know that maybe when restrictions are lifted, myself, Dr. Patrick, and maybe some other doctors can come out and visit and do some awesome talks about a lot of different things: immune system, hormones, inflammation. But we would love to be able to bring the Wellness Way to the wonderful country of Canada. You guys just have to get loud about changing some restrictions, because we're not coming in until those are lifted. So let's talk, guys, about looking at cancer differently, part 2. This should be really interesting, guys. And if you find this valuable, please make sure that you share this with other people, because whether you guys realize it or not, cancer is either going to affect you or it's going to affect someone that you love. So it's really important to start thinking about it now, obviously, than later. So just a couple of things, guys. If you don't follow me specifically, I am on TikTok. Guys, we have a video right now on TikTok about losing your gallbladder and what you need to do. That is now approaching 2 million views on TikTok. The comments are just incredible. Most of them encouraging for the most part. And guys, if we ever fall off the face of the earth on Facebook, we are on YouTube. If we fall off the face of the earth on YouTube because we get banned for some reason, or shadow banned, which does happen, we are on the Rumble platform as well. So all of our live videos that we do, we will upload them to YouTube, we'll upload to Rumble, and then also, which I think this social media platform is probably going to be the wave of the future, Truth Social. All right, so please make sure you follow me at each one of those different ones at Dr. Nathan Thompson. So I'll actually post different videos on TikTok than what we post on Facebook, and then all of our live videos are then uploaded to YouTube and to Rumble. And then sometimes I get a little bit sassier on Truth Social because it's not censored as heavily as some of these other platforms. All right, so guys, as well, I know that just as an FYI, we have a lot of people who reach out and they want very, very specific medical advice or health advice. And usually what they say is they give a very incomplete picture of saying, what supplements do I need to take? This is what's going on in my labs. What do you think that it is? And guys, unfortunately, I can't respond to those things. I don't have all of your labs. I don't have all of your history. And, honestly, we just can't give a bunch of free medical advice, which actually upsets some people. Which is okay, but just understand, guys, that when we do lives and on this specific platform, I go over general ideas and things like that. And so if you really want answers. And, I always tell people is please quit trying to do it on your own. Get some coaching, and the best coaching and the best way is to have some people who have seen multiple people who are like you, who have had clinical success, and who can quite honestly do it better than what you can do it, trying to figure it out, obviously, on your own. Is save time, save money, and get your health back as quickly as possible. Please work with a Wellness Way doctor. If you are from the Chicagoland area, please reach out to us. But if you are not from the Chicagoland area and you are in Canada, or if you are in the United States, please go to thewellnessway.com, and you can go right up here. You can find a clinic, or you can consult a doctor. I know that for us, our remote consults are way booked, and so we just don't have the capacity for me to be able to do remote consults with you, but there are doctors who do have availability. So please go up here and then consult a doctor and see if you can get a consultation with a doctor, or numerous consultations, because guys, sometimes these things, they're just not fixed by talking to someone for 30 minutes. So please work with the Wellness Way doctor. I always say, you need to get from to B, so go from point A to point B without taking all of these different detours, guys. Because for some of you who reach out and you want advice, you've been on a journey way too long. It doesn't need to take that long, and you're trying to figure it out. Guys, just bite the bullet, get a consultation with doctors, start working with them to help you get better as quickly as possible, so you can, rather than focus on your health, you can focus on your family, or you can focus on some other things that are important, because nothing can be accomplished if you first don't have your health. So please go to thewellnessway.com. Please, guys, find a doctor, okay? Now, let's talk about cancer. Before we do that, guys, coming up, we just had an inflammation talk last week. It was awesome. Our next one is coming up. I believe it's June 7th, right when we get back from Memorial Day, about a week after that. So if you're from the Chicagoland area, guys, all you have to do is go up to the top of this page. You'll see our next inflammation talk pinned to the very top of the page. And so, guys, please make sure that you register for that. If you understand, first and foremost, how to handle inflammation, first and foremost, it sets up everything else: weight loss, infertility, cancer, thyroid disease, arthritis, type 2 diabetes, autoimmune issues, hormone imbalances, and things like that. Guys, even the consultations today, we saw some pretty unbelievable hormone changes in people, but also some hormone issues in some people that had no idea that were going on. And you can trace it back to inflammation, you can trace it back to the liver, you can trace it back to a lot of different things. Guys, Wellness Way doctors are masters of what's known as the Swiss watch principle, because we understand that it's not a this for that type of thing. We understand all of these different body issues, body processes going on, so we know how they work in conjunction with one another. So go to the top of the page from the Chicagoland area. That is the next time that we will be accepting new patients. Will be on June 7th. We can't wait to see you guys there. So on to the bread and butter, what I'm going to talk about tonight, guys. And if you are enjoying this, again, please make sure that you are sharing this with other people. So when we talk about lab markers, I want to first ask you a question. And I'm going to ask some tough questions. And I just want you guys to remember is, in order to make progress, we have to ask tough questions. And many times when you ask a tough question, people get emotional about it as well. So if you're getting emotional, ask yourself why. So the first tough question I want to ask is, are we truly surviving cancer? Okay, are more people surviving cancer longer? Because when they say we've made so much progress in the field of cancer and survivability, the reality is that we really haven't. What we've done a better job of is actually detecting cancer earlier. So people are not necessarily living longer with cancer as much as they're living longer with the cancer diagnosis. So we're just finding it sooner with technology. And so the treatments and things like that aren't really extending life. We're just finding it earlier. So we attach a diagnosis which says, yes, you've had cancer, 50 years ago, we would find cancer when it was stage 4 cancer and a person had 6 weeks to live. Now we're finding it when there's a stage 1 cancer and people are now living 4 to 5 years. The outcome is the same, it's just you have the diagnosis attached to it for a lot longer time. So it doesn't mean that those testing aren't valuable, but the reality is that we're really not doing things in order to change the physiology that brought on the cancer in the first place. Remember, it's all about lowering the amount of cancer that you're making and raising the body's ability to be able to fight it, which is largely an immune response, okay? So are we truly doing it? I'm going to give you an example. So there's different phases of cancer. And here you have at the end when it becomes invasive cancer, which means it's gotten to the point where it has now been able to go through a specific tissue structure, create specific enzymes that can cut through soft tissue, that actually can grow blood vessel formation, arterial formation, and could actually go through and then go into the circulatory system to be able to spread and become what is known as metastatic. So then you got an invasive cancer, which at that point it can be very tough in order to handle because it's become something that is systemic. Then you got what's known as an in situ cancer or an in situ cancer, which means in place. So it means the cancer is there, but it has not spread to other body systems, to other organs. Guys, I will tell you this, no one actually ever dies of cancer. What you die from is when the cancer grows to a point that it compromises a specific organ function. It just crowds out specific organ functions over time. So all really cancer is uncontrollable cell growth that's not being kept in check by the immune system, or maybe it has gotten to the point where it's growing so fast that the immune system can't keep up. So here you have cancer in place. If you go a step before it, you have what is known as dysplasia, or the growth of abnormal tissue. And then you have what's known as hyperplasia, which actually isn't cancer, but it's actually a reactive response to some kind of irritation that's taking place. A perfect example of hyperplasia would be something like colon cancer, would be like esophageal cancer, where the tissue actually adapts to a very inhospitable environment, and the tissue has to adapt. Otherwise, what happens is the tissue actually dies or perforates or something happens to it. So you have a tissue response, a hyperplasia, but before that even happens, guys, you have to have a cell with some kind of mutation. So really what we have done as far as cancer diagnosis is, instead of finding it here, well, we got better at finding it here, and now we're trying to find it when it actually is happening here. So are we actually finding it in which there is a change in physiology taking place, so that we see the change in physiology and we know that at some point that's going to become cancerous? Let's work on changing the physiology before it actually turns into cancer. And no, finding a genetic defect is not finding necessarily cancer. Because a lot of times we say, okay, well, I see the genetic mutation with a specific gene, let's actually just cut the breasts off. Or, ovarian cancer runs in my family, let's just do a hysterectomy. That's not treating cancer, that's actually cutting out the tongue of someone who is crying. So tissues don't become cancerous for no reason. And this is why even you can cut the breasts off, but if you don't change the physiology, you can still have cancer take place in other parts of the body. So you just don't cut off the tissues, you change the physiology that would cause the change within the tissue. So we're just finding cancer earlier and earlier, which means if we find it in, for example, a phase 1 type of cancer, ductal cell carcinoma in situ, which is basically a grade 0 or grade 1 type of cancer, we're finding it there. You got the diagnosis of breast cancer, you make it 5 years, and they're saying, congratulations, you made it 5 years, you are now considered a survivor, which they used to find it here, and the person might have lived 1 year, and they say, oh, well, this person wasn't considered a survival, and they died of cancer. So they do change, they do manipulate some of the statistics in regards to that, but the reality is that when you look at cancer treatment outcomes, we're really not living longer, we're just living longer with the actual diagnosis, okay? So if you look at the testing today, and this is what I always will ask people, is especially with people who have concerns of cancer, or maybe they've had a previous diagnosis of cancer, is I always ask, I say, well, when would you want to know if you had cancer or not? So let's say the size of the cancer is this big. And I ask people, would you want to know if the cancer was this big? And people say, absolutely, I would want to know. I say, okay, great. Well, what if the cancer was, instead of this big, what if it is now this big? Would you want to know? People say, well, I still would want to know if this is happening. I say, okay, well, what if instead the cancer was the size of a period at the end of the sentence? Would you want to know? And people say, yes, I still would want to know. I say, great. What if the cancer, instead of the size of a period, which is still going to be hundreds of thousands of cells, what if the cancer was just a collection of let's say 500 cells? Would you still want to know? People say, yes, I still would want to know. I say, well, let's take it a step further. What if you had the physiology that was going to lead to the progression into cancer? Would you want to know? And people say, yes. And I say, well, that's what we're testing for instead. But when you look at medicine and a lot of the testing that they're doing, really what they're doing is they're looking at instead of looking at a physiological view, they're looking at with a camera or with some kind of X-ray, some kind of MRI, and they're trying to say, okay, can we see what's the smallest thing that we can see, basically with the camera, with an X-ray, with mammogram, what can we see regarding that? So it's only going to be as sensitive to what that specific type of technology can actually pick up. So this is considered an upper GI, and so when you look at upper GI, which is basically going from the mouth down, especially when you look at the esophagus right above the stomach, and you actually see that there's some red tissue that's going on. So they're going to look at that and look, for example, esophageal cancer, which is basically an adaptation to that lower esophagus being chronically exposed to a lot of stomach acid. And it's not a high stomach acid issue, guys, because it cannot happen. You cannot produce too much stomach acid, because if you understand rest and digest and fight or flight, the only thing that can happen is you don't have enough stomach acid, which causes regurgitation of stomach acid through the actual sphincter, the esophageal sphincter, and it will come up and regurgitate itself into the esophagus. And when that happens, that irritates that tissue because it's not supposed to withstand a high acidic environment. So the tissue reacts by adapting and changing, and then it can turn into cancer as an adaptation. So they're seeing that there's inflammation, they're seeing that there's tissue changes that are taking place, but are they actually trying to figure out what's the physiology that's causing this in the first place? If you look at this, the doctor says, yeah, we're seeing some changes in physiology, here's a reflux medication, when that's not actually getting to the cause. So they're only picking up what they can detect on specifically what a camera can see. This is a lower GI or colonoscopy. So you see as they enter into the colon, well, that's obvious right there. That is considered a cancerous tumor or maybe just a polyp. But what they're actually seeing is they're seeing actually dysplasia take place, and they're seeing the presence of tissue changes to the point in which this is considered a tumor that is starting to develop. So remember, even when they're doing a colonoscopy, because I'm going to talk about colon cancer and some testing that can actually, rather than waiting until you have a colonoscopy and they're saying, yep, you have polyps, you need to change the way that you're eating, it would make a lot more sense to be able to look at physiology and lab markers that are showing that it's taking place when you're 25 years of age, instead of waiting until you're 50 and then trying to make some kind of drastic change, because sometimes you might not be able to slow it down. So this can only detect the presence of disease that's already there. Thank God that they can do it, but I'm going to show you some better things in my opinion. Now, the next thing is everyone says, well, I need to get my mammogram every year. So after a certain age, I need to get a mammogram every single year. And guys, I will tell you this. If you want to get breast cancer, get a mammogram every single year. Because if you have a change in physiology of the breast tissue due to a change in hormones and a change in your immune system, if you keep radiating that specific area every single year and exposing it to ionizing radiation, we talked about this last time, about ionizing radiation actually being one of the causes of cancer, then keep getting a mammogram every single year. In fact, Lancet a long time ago said, I don't know if it's actually worth it to be doing this every single year, because remember, there's a lot of false positives when it comes to mammography. When there's a lot of false positives, there's a lot of women who are going through a lot of mental trauma over the fact of going in saying, I might have breast cancer, we need to go ahead and do a needle biopsy with that. And, a lot of times just the whole idea of having some kind of false positive can be devastating, especially to a woman. But mammography is actually looking at X-ray, and so it's still only detecting a tumor that's already there, but it may detect a tumor sooner than actually doing maybe a self-exam, a breast self-exam. So, there's things that you can do that take it a step further, because remember, in order for this to happen on a mammogram, then there has to be a change in hormones and a change in physiology before a tumor will actually develop. So this goes back to saying, when would you want to know? When it's already there, or when the physiology is present to actually cause it, okay? This is the same thing when it comes to lung cancer. It's the same thing when it comes to breast cancer, brain cancer. Again, it's only as sensitive as what they can see with an MRI or what they can actually see with an X-ray. So are there lab markers that you can test for that can detect the presence of things building inside the body? Absolutely, yes, 100%, and we do it every single day. So guys, what's better than early detection? Because the whole fight with cancer is all about, we need to detect it sooner, we need to detect it sooner, we need to detect it sooner, which is getting people into a system of doing things like colonoscopies and mammograms. And again, those are only as sensitive to what you guys can actually see with the naked eye. And no one's talking about, hey, can we be doing testing to see changes in physiology or changes with the immune system that would make a person have a much more hospitable environment for cancer in the first place? So what's better than early detection? Number one, seeing changes in physiology, and you can correct the physiology before it turns into the adaptation of cancer. Or number two, just work on never getting cancer in the first place. And actually, the next part that I want to go over on part 3 is actually talk about some basic principles that you can do in order that would make the body inhospitable towards cancer. Guys, things like sugar, things like insulin levels, which doctors aren't measuring as well. And it's not necessarily a panacea, but guys, if we were doing certain things, you would see the level of cancer dramatically go lower. So what's better than early detection? Seeing changes in physiology before the cancer actually develops to be seen on all of these other tests. And then number two, to work like you already have cancer and to work on it with your lifestyle so that it never happens in the first place. So the question I want to ask you, number two, is, are we truly changing the physiology that caused the cancer, or are we just reducing a tumor load sooner? So with this quote-unquote war on cancer, are we truly changing the physiology that caused the cancer, or are we just focused on cutting out the tumor or reducing the tumor load a lot sooner? Just remember this, you can throw out poison and you can kill the rats, but if you never clean up the garbage dump, the rats come back. So one is just killing off the rats, the other one is changing the reason why the rats showed up in the first place. And this is what, in the wellness way, is when you say, do we cure cancer? Absolutely not. In fact, nobody cures cancer. The body actually is responsible for curing everything. And yes, you can reduce a tumor load in someone, and yes, it's not necessarily a bad thing, but ultimately you can cut cancer out, you can radiate it, you can give chemotherapy, you can poison it, you can burn it, you can do all of those things, and yes, some people need that in order to lower the tumor burden, but it also comes down to changing the reason why it happened in the first place, and that is truly being concerned about how to change physiology. You have no idea how many people come in and they have had cancer and say, well, what did they recommend for you afterwards to make sure that the cancer doesn't come back? Do they recommend anything in order to rebuild the immune system? Did they recommend anything as far as changing your estrogen physiology? Did they change anything as far as, the reason why your prostate became cancerous? Did they want to change anything as far as, what happened within the colon? And it was, nope, they said, we got it all. but they never change the physiology, which means it's only a matter of time before it actually comes back if you do nothing to change the physiological reason why it happened in the first place. So let's go over some labs that leaves clues, guys. This is going to be really interesting because a lot of the labs you may not actually have heard of. Maybe some of you have, but I want to go over with you some labs that are very specific to different types of cancers that you should be getting or that your doctor should be running, but no, they probably won't run it, but Wellness Way offices will actually run these specific lab markers. Guys, and this is why the labs that we run, this is why they're not covered by insurance, because insurance only covers labs that you can provide basically a medicine for an abnormal lab. So a lot of times people say, my doctor refused to run this. I'm like, well, that makes sense, because if you do an immune panel like you're seeing here, what is the prescription drug solution for someone who has a low CD8 count? There is none, okay? So if they cannot provide an answer for you, there's no reason to be able to run the lab. So this lab right here is Wellness Way Immune System Panel. It's called an expanded lymphocyte enumeration. Lymphocytes, specific type of white blood cells, things like CD4, CD8, CD19, natural killer cells. So when you look at this is looking at specifically the types of cells that are responsible for tumor suppression. These are specifically your CD8 cells, CD4 cells are very important. And so we run this especially on people who have had cancer. So when you look at this person, we ran this on someone who had had breast cancer and underwent chemotherapy. And let me ask you something. They underwent chemotherapy, the tumor shrunk, but when you look at her immune system, you can see critically low in CD4 cells, critically low in CD19 cells, which are considered B lymphocytes, overall critically low white blood cell count, and then vitamin D levels, actually, which are responsible for elevating these CD4 cells, you can see very low. So what do they have, guys? And in fact, all you have to do is you just have to do a Google search on really what CD4 is, and they'll say it's basically a health marker of your immune system. So this person, after treatment, was left immunocompromised, which is the very thing that prevents the tumors from actually coming back, because ultimately cancer is going to be a failure of your immune system response. And so what actually causes this? There's a lot of different reasons why, but chemotherapy will actually kill off the immune system. So yes, you lowered a tumor burden, but actually what was left was you left an immune response that was worse off than possibly even before someone had cancer. So what you do is you poison a tumor, but never change the physiology, and you leave the body's ability to be able to fight it off even worse, which means it's not a matter of if the cancer comes back, it's just a matter of when. So this is why doing an immune system panel is of critical importance, especially for people who have had a previous diagnosis of cancer. Now, another cancer marker that is really important is also called CEA, carcinogenic embryonic antigen. They do run this sometimes, especially with people who have had colon cancer. Now, we run this on every single immune system panel. When this elevates, that is a marker that there is some quickly dividing, growing tissue within the body. Now, full disclosure, I took this on myself about 1.5 years ago, and my markers were at about 5, and anything that is cause for concern is anything over 3.5. So I freaked out just a little bit. I remember I called up Dr. Patrick Flynn, and I said, hey, listen, my CEA is elevated, it's at 5. And he said, oh, I know why. He said, because you work out like an idiot, which is kind of true. I do work out a lot, do a lot of metabolic conditioning, weightlifting and things like that. That's a passion. It's a hobby, kind of. It's my stress relief. It's my catharsis. And he said, you have a lot of damaged tissue that's quickly trying to rebuild and repair itself. That's one of the reasons why. Test it again in 3 months. Don't work out so much. I followed his advice, and my number went, back down to normal. So yes, it can happen in extreme types of exercise. Yes, but if you see that this level is elevating, a lot of times we'll say, okay, we need to keep an eye on this. But when you start seeing it get up to 8, 9, 10, 11, 12, 25 and things like that, it can actually see, all right, how bad is it? Like, we know that there's something that's there. Now, how quickly is it reproducing? How quickly is it dividing? How quickly could it be spreading throughout the body? This is actually probably a good marker to actually say, yes, this person probably does need chemotherapy in order to really do what the immune system has failed to do, because you probably can't build up the immune system fast enough in order to get sufficiency to the immune system to be able to start to handle this. Because remember, all chemotherapy is doing is it's doing the job that the immune system failed to do. Hopefully that makes sense. So CEA is another marker that we will watch in people, carcinogenic embryonic antigen, okay? Let's talk about breast cancer. So remember, you have mammography, but remember, that's invasive. That's ionizing radiation. So if you already have a tumor in there and you're then isolating it, pressing down on the tumor, putting pressure on it, that could cause a squeezing of that tumor to actually go through specific tissue to get potentially spread, and then putting ionizing radiation directly into it, that's a good recipe for causing a progression of cancer, okay? Now, one of the things that is least invasive, more or less, actually it's not invasive at all, because there's zero ionizing radiation, is called breast thermography. So just remember this, a tumor has a higher metabolic rate. If something has a higher metabolic rate or has inflammation associated with it, then what you're going to see is you're going to see hot spots when you take a thermographic picture. So thermography, the reason why I absolutely love it, especially if people have some concerns, is that you could actually do this first, and doing this first can raise the possibility of, hey, there's something that could be going on. So I always recommend get a baseline for this first, and then if there's anything that is suspicious, then go back and then reassess it after 3 or 6 months. And that way you can see, based on thermography, if the physiology is improving or if the physiology is actually getting worse. And just remember, there's no ionizing radiation with this. A licensed thermographer can look at this and make recommendations involved with this. But obviously, this person within the breast tissue has a change in physiology. Remember, there's got to be a change in physiology before there can be any kind of tumor progression, okay? Now, what I even like even more than that, than looking at changes in heat or changes in metabolic rate is going to cause more heat, is actually when it comes to breast cancer, look at how you are metabolizing your hormones. The thing with breast cancer is, just remember this, is that first you have to ultimately have a failure of the immune system, but the other thing is too, is you have to have some kind of oxidative damage. Remember, breast cancer is something that is sensitive to specific hormones. So yes, you can actually test your estrogens to see how you're metabolizing your estrogens, because there's certain estrogens that are more mutagenic and is causing damage to DNA if you cannot properly detox those from the body. So a lot of people don't realize is when they say, I'm on an estrogen blocker. This happens a lot after breast cancer treatment, because doctor says, well, estrogen causes cancer. No, it doesn't. Estrogens do not cause cancer. Only specific ones can lead to damage to the DNA. So a lot of times what they'll put people on is called aromatase inhibitors. These aromatase inhibitors, they inhibit the conversion of testosterone into estradiol, in which will put a woman in early menopause if she's still having a normal menstrual cycle. And so they just decide they're just going to clear-cut block it, which then runs into other issues regarding the uterus and the cervix. So you can measure all of these different estrogens. Only one of them is estradiol. You got estriol, which is the weakest form of estrogen, and you also have estrone. Now, they are metabolized down specific pathways. The pathway that is the most damaging is known as the 4-hydroxyestrone pathway. So you have specific enzymes that will cause it to get metabolized into those different things. Those specific enzymes, whether you're increasing or decreasing its activity, is 100% based on lifestyle, toxicity, lack of nutrients. So there's a lot of different reasons why you can metabolize this. This is actually someone who's considered healed from breast cancer, was medically put into menopause, even though she's not of that age. And you can see, even despite that, and having literally menopausal amounts of specific hormones, even lower than menopausal amounts, you can still see that even despite that, the physiology was not changed in order to prevent breast cancer from coming back, because she's metabolizing a huge amount. You can see right there, 24% when it shouldn't be more than 11% down that 4-OH pathway. And so you can see she's still producing, even after chemotherapy and radiation, she's still causing breast cancer. So you can see that one of the things that will happen is that this hormone is what causes damage to the DNA, which then changes the breast tissue's DNA, and then that is what can cause the oxidative damage that they can cause cells to react by dividing out of control. So just remember, if not detoxified, 4-OH estrone can bind to and damage the DNA. And this is why, guys, someone needs to be actively detoxing and properly detoxing. One of it is called methylation, which is why if you have issues with methylation, you're going to have a hard time removing your estrogens every single month. And please, I will beg you, please don't listen to people who randomly throw around detox all the time. And in the same aspect, please don't listen to these people who say you don't need to detox because your liver and your kidneys do it for free. Both of those people have no idea what they're talking about, because no, you cannot detox if you do not have sufficient nutrients in your body. So how do you know if you should quote unquote detox? Well, one of them is by testing for this properly and then understanding truly what detox is. Methylation, there's different pathways that you have to be able to address. Only one of them is methylation. There's other pathways that are involved with it as well. So every day your liver is detoxing, but when can't it detox properly? When there is insufficiency of nutrients, number one, or number two, the toxic burden is happening too quickly for the liver to be able to get rid of. And this is one of the tests that can see what is my estradiol, what is my estrone, what's my estriol metabolism look like, because this right here is the physiological reason why breast cancer actually develops, and then ultimately you have a failure of the immune system after that. Now, what about colon cancer? Okay, so a lot of people say, well, after 50, you need to get a colonoscopy. Now, there is risk involved with a colonoscopy. One of the risks is perforation of the colon. So these tests aren't just benign, there's risk associated with them. So what can you do versus getting a colonoscopy at 50? Well, I'm not 100% against it. I've recommended it for some people, but what we recommend before that is to get what's known as a Cologuard. Okay, now Cologuard, you can actually order this online, and you can request that a doctor associated with Cologuard can recommend this to you, do a telehealth visit, and do this test, because it's a stool test that actually will screen for colon cancer. So we've had people who have taken this and they said, yeah, there's no issues that are going on. So we're saying, hey, if you were my brother, sister, mother, I wouldn't recommend getting a colonoscopy. Now, sometimes the Cologuard comes back as a screen for cancer and say, yep, there's some things that aren't going on that are so good. And then we say, okay, now then would be a time to then do a colonoscopy to look and see if there's any pathological changes within the tissue. Now, you can take this even a step further, because what it's really about is about the physiology. It's about the physiology, about changes with the physiology. So can you see some changes with physiology that are associated with colon cancer or with the future development of colon cancer? Yes, there is, absolutely. I don't know if you guys had seen, some news articles and things like that where they said, hey, we actually now have trained dogs to be able to sniff out colon cancer. And here's what's really interesting about that is because when someone has a highly inflammatory environment that then prefers an adaptation known as colon cancer, you're going to see an overgrowth of certain bacteria. One of the bacteria is sulfur-producing bacteria, which means that technically you could even smell someone's flatulence and notice that something is not right within the colon. So yes, even changes with how flatulence smells, or if someone is extremely gassy, there's something that's going on that's not right within the gastrointestinal system. So yes, you can actually measure changes in fecal secretory IgA, which is inflammation of the small intestinal barrier. You can actually see if they're getting enough fecal fat, which will actually show if there's any gallbladder issues as well. If your pancreatic elastase is very low, here's someone who's got extremely low pancreatic elastase, which means they might have actually gallstones, or they might have type 1 diabetes because their pancreas is not functioning very well, which means if they have an autoimmune reaction that's causing type 1 diabetes, they'll also be very deficient in pancreatic enzymes involved with digestion. But if someone has any kind of destruction, even associated with pancreatic cancer, they're going to be low in this pancreatic elastase. But then you can also see when you look down here, this is very specific to colon cancer, because there actually is research that shows that when beta glucuronidase, which is an enzyme within the colon, is extremely high, that there is a correlation between elevated beta glucuronidase and colon cancer. So you actually look at this person, their levels are at 12,000, and at the high end limit is at 6,000. So it's twice as high as the high end limit. So we have actually seen clinically when this is elevated, especially with people who have had colon polyps, and we look at their beta glucuronidase, we have always seen that this is extremely high. And there are ways that you can actually start to lower this and lower the physiology. A lot of it is by helping to balance the microbiome, helping with short-chain fatty acid production, but there's also specific things that you can take to lower that enzyme known as calcium D-glucarate. So this right here, in my opinion, is a good indicator on whether someone will develop colon cancer if it's not already there, but physiologically something that you got to be concerned about, especially down the road. Now, what about prostate cancer, for example? You guys have probably actually have seen that a marker for prostate cancer, or if something is changing within the prostate-specific antigen, okay? Now, prostate-specific antigen, you will see that there's going to be some changes taking place within the specific prostate, leading to hypertrophy, leading to tissue changes, finally leading to prostate cancer. I came across this lab, and this was really interesting because this person didn't necessarily come in. They didn't tell me that they were having some problems with their prostate. They came in for other reasons, and I looked at this and I said, okay, this doesn't make sense. This person had actually had colon cancer in the past. So he looked at CEA. CEA markers were actually pretty low. Looked at the PSA, and he saw that the PSA was actually fairly low as well. But then I saw something that was really interesting. Very low testosterone, but very, very low what's known as DHT. Like extremely low DHT. Like I've never seen that before. So I remember asking this person, I said, hey, why is your dihydrotestosterone so low? And he said, well, that's because I am taking basically a medication that's very similar to finasteride, which is called a DHT blocker. A lot of men take that in order to prevent balding. He was taking a DHT blocker because his DHT levels were so elevated that his prostate was growing to the point where there was blood in his urine, okay? And it was only a matter of time before that would have created a cancer type situation that's going on. So you can measure on top of just PSA the things that will cause a change in pathological tissue within the prostate And one of the biggest ones is checking a man's estradiol levels and checking a man's DHT or dihydrotestosterone. One of the reasons why is DHT is 10 times more potent than testosterone, which means that it can grow some tissue pretty quickly, especially if there is a hormone receptor for it, in which the prostate does. So what they did is they gave him a DHT blocker, and that DHT blocker quickly lowered his DHT levels, which shrunk his prostate. And you're saying, well, hallelujah, that's really good. But the problem is that it actually left him with very high estradiol levels. So you got to be really careful when you're taking any medications that is manipulating hormones, because you don't know what it's actually going to turn into. The answer instead would be to, let's fix your lifestyle so that your body is not converting your testosterone into DHT, because there's very specific things that you do with lifestyle that can convert it into DHT. Other people, if you don't realize that saw palmetto, for example, is considered a DHT blocker. So which is why when you guys say, yeah, saw palmetto for benign prostatic hypertrophy or prostate cancer or things like that, well, because it inhibits the conversion of testosterone into DHT. So I have actually given that to men, and it's shrunk their prostate. I have actually also given this to women as well, because there are some women who have some big time problems with testosterone into DHT, and a lot of them have issues with PCOS, okay? So looking at hormones can also play a role even in men, because men do suffer hormonal cancers, and for men, one of them is going to be the prostate and prostate cancer, okay? So I want to leave you guys with this, okay? Cancer, and this is probably not going to be received too well by a lot of people, but cancer is a psychological emergency, and it's rarely a medical emergency. So I want to let you guys know that if you've had a diagnosis, a lot of times what people do is they freak out. And actually the psychological trauma is much, much worse than the diagnosis itself. And I'm going to give you an example. I had a patient who was basically diagnosed with stage 0 to 1 breast cancer. Really what that means is that you really do have a lot of time before it's considered stage 3 and stage 4, okay? However, she was freaking out because when you hear cancer, it is a psychological emergency, and many times doctors are going to say, you need to do this treatment, you got to do it right away, you don't have time, and you got to make a rush decision, when in reality, she doesn't have to make a rush decision. She has options, and what she should do is get out of fear and then calm down and make a rational decision, because one thing a doctor won't tell you is that you have time to make a rational decision. And in her case, it was not a medical emergency. I didn't say that it's never a medical emergency, but in many, many cases, I will say the overwhelming majority is that you have time in order to look at your options, you have time in order to test things properly, and you have time in order to say which option is going to be the best. And just remember, because when a doctor finds cancer, it's going to be cut, it's going to be poisoned, it's going to be burned, but it doesn't necessarily have to be that way. So this is why testing those things properly. And if you have a stage 0 or you have a stage 1 cancer, test the immune system, test your hormone metabolism, get a thermogram and see that physiology. Retest it in 3 months, in 6 months, see how the physiology is changing. Retest your Dutch test, retest your immune panel, and see how the body is starting to handle those things. So remember, guys, is that more times than not, it's a psychological emergency than it really is a medical emergency. And just remember that in an overwhelming majority of cases, you do in fact have time to weigh your options and to be able to think things through. Because remember, once you are in fear, you will be grabbing straws at that point, and sometimes you will not make the best decision. We know this by what happened over the last 2 years with the pandemic. Many people made bad decisions, not because they don't have this, was because fear was overriding their mental capacity to be able to think and to be able to be able to think things through and rationalize and reason things through, especially. Okay, so guys, next time that I see you, we'll be going over part 3 as the best cancer cure. Wow. I put cure like this because there really is no cure for cancer, but I'm going to show you things that you can do as far as lifestyle that can make a dramatic difference as far as if you are developing cancer or not. And these are things that every single person can be cognizant of, can start doing every single day. Before that, guys, though, again, if you're from the Chicagoland area, coming up June 7th, we're going to be doing our inflammation talk. Go to the top of our page and you can register for that for free. This is an in-person event, but we'll talk about inflammation first, guys. And when you come to that, it will make sense as far as why we test things, why we do what we do, why we x-ray people, and why we recommend certain tests for some people. And I will promise you this, once you understand, you will become empowered. Once you become empowered, it will help you to make the best decision possible. So guys, again, I appreciate you joining me. Please share this as well, because cancer impacts not only you, but it impacts, if not you, it's going to be someone that you know and someone that you love. So give them hope, give them a different perspective, and I hope they listen just like you guys did. So guys, be well. I hope you have a great rest of your week. I'll probably join you on Wednesday for something very interesting in regards to some research that I came across. So I hope you join me as well on that day. So guys, be well, be blessed. We'll see you very soon.